Prostate, let's talk about treatments. Active surveillance I consider a treatment, it's following, but prostate cancer is one of the very few cancers in your body where you have a choice in how you want to treat your disease. Whether you have colon cancer, lung cancer, it's pretty much worked out for you. You go from A to B to C. It's basically very algorithmic, where you just follow a recipe. Prostate cancer, you have a choice, okay? It's good and bad. Some guys like the choice, some guys get frustrated and overwhelmed by the choice. What I try to relate to the patients is give them a menu, a choice of what are reasonable options. And to be honest with you, it comes down to the side effects. What causes the least side effects or what you're most comfortable with? The analogy is it's like going to Chicago. We'll get you to Chicago. We're in Detroit today for those of you watching online. We'll get you to Chicago, we'll cure you of this disease, but how do you want to get there? Some guys like to fly to Chicago, some guys hate to fly, they'd rather drive. Some people say, I'd rather be on the train. And that is very similar to how we treat prostate cancer. Everyone has their own biases, their own comfort levels, and our job as a urologist is to let the patient decide on how they want their disease to be treated. And part of the mission of US2 is to inform our patients, to use US2 as a resource to make an educated decision. You know, people always come into my office, sorry doctor, I looked on the internet, I'm sorry. I think that's great, because then I can have an intelligent conversation about the good and bad of every disease. So I encourage you to go to websites like US2. I encourage you to talk to your friends who've been treated, to talk to other prostate cancer survivors, because that's how you're going to understand the treatments themselves more than I can offer, to be honest with you. I can tell you medical stuff, but the guy who's done it will give you more information. When you look online and read patient testimonials or see videos, that will give you a better understanding of how you want to treat your disease.